In this video, we're going to talk about the pros and cons of peritoneal dialysis. If you were diagnosed with renal failure and you need to start dialysis, you have to choose between hemodialysis and peritoneal dialysis. Hemodialysis is the more traditional dialysis, and that involves taking out your blood and running through a machine where it gets filtered and then put the blood back into your body. And hemodialysis usually is done at a dialysis center where the nurses poke you with 2 needles in your access to be able to remove the blood and replace it in your own system. Hemodialysis can also be done at home, but it's fairly complicated since it involves putting needles into your arm or managing blood at least 3 times a week. For peritoneal dialysis, an interventional radiologist inserts a soft, flexible tube in your peritoneal cavity, and through this tube we can inject a special fluid called dialysate that will essentially filtrate your blood through the peritoneal membrane. And there are several advantages of peritoneal dialysis. One of them is that it seems to be more gentle. It's done every night at your home, usually when you're sleeping. Since it can be done at home, it also provides independence to the patients, and they can have a normal work schedule if they want. They can also travel with bags, and they can do dialysis anywhere, including in a hotel. It also has less dietary restrictions, and it doesn't involve getting poked with needles and dealing with blood. There are some disadvantages to peritoneal dialysis too. The first thing is you actually need to have enough space in your home to store all the supplies that are necessary, including the bags of fluid. The other thing is that peritoneal dialysis, although it's not very hard, it requires the patient to be involved with their care. And some patients just don't want to do it. They prefer to go to a center and get it done. Another issue is that peritoneal dialysis only lasts for 5 to 7 years. Because remember that membrane, the peritoneal membrane that I talked about? After some time, it may become thick and may not work as well for dialysis. But the good news is, after 5 to 7 years, you should almost be ready to get your transplant, so it's almost the ideal time. Nowadays, these catheters can be inserted using minimally invasive techniques, using X-rays and ultrasound with minimal sedation and local anesthetic. It can also be placed anywhere in the abdomen. Therefore, you need to discuss with an interventional radiologist to decide which one is the best place for you. The procedure usually takes 15 to 20 minutes, and the patients usually go home the same day. If you're thinking about peritoneal dialysis, I hope this video provided some information to help your decision. This is Minimally Invasive Insights, and I'm Dr. Fabio Komlos.